All right, well, welcome back from your break. Um, so we're going to go ahead and get started, and I think we're right on time with this. But disclaimer, so I am click happy. I just clicked to the end of the presentation. But we're not done yet. We still have another hour and a half on this part of the presentation, but just joking. So anyway, so my name is Bola Ogundimu. I'm an infection preventionist with the long-term care team, working closely with Dr. Namali Stone. And a lot of you, I think, went through her talk for the last 2 days now. So welcome to day 3. But for this session, we're going to digress a little bit. I'll be talking about our state public health partnership with facilities that we've had so far. So it's actually called the Infection Control and Response program or project or activity. And you'll hear me talk about ICAR for a little bit for the next few slides. So if you go through this presentation and make it out okay, you can deem yourself ICAR-ified, if you put it that way. Kind of like Samified, but ICAR-ified in a way. So my objectives for today include talking briefly about the ICAR activity, and then also talking about findings and lessons learned by the different state and city health departments from this activity in long-term care settings. And then I'll also be talking about specific examples of educational materials as well as resources that you guys can use at your facilities. So a little bit more about the ICAR activity that started in 2015 when CDC gave multiple states funding to provide really technical support as well as a structural approach for assessing infection control programs at facilities all over the U.S. And it also provided the health departments an opportunity to expand their outreach to those healthcare facilities all over their states, as well as provided a resource for facilities. And I'm also a polling person, but for the sake of time, we'll skip the polling right now. So back to the ICAR. The ICAR, I wonder if some of our people have had the chance to check out our ICAR tool. How many people have seen it? Okay. And at the end of my presentation, I do have the web link, so you guys can go ahead and check it out and also get in contact with your state health department if you're interested in participating in these assessments. They're free, by the way. They're non-regulatory, so you get another partner that you can add to your speed dial at your facility if you need any help with infection prevention and control activities, assessments, and other issues outside of responding to an outbreak situation. So the infection control assessment tool has multiple parts, and some of the elements or some of the questions are focused on policies and procedures for infection control at your facility, as well as staff training and education and how it's done at your facility, in addition to auditing and monitoring of adherence to your infection prevention and control policies, and also providing feedback to staff adherence and availability of supplies for your infection prevention and control practices at your facility. So overall, there are multiple domains, and the domains are listed on this side of your screen. For the sake of time, I won't go into every single one, but we'll talk about how those look or have looked for especially nursing homes in the U.S. over time. So at the end of the tool, if you get the opportunity to download it, you'll find that we also have your auditing tools for your hand hygiene as well as gown and glove use. Now, to note is the fact that when these health departments went out to the facilities, the auditing of practices was noted as an optional opportunity. So if the health department deemed it maybe necessary or helpful, they went ahead and also did the optional observation. But we've also recommended that facilities take a look at it and they can use it as their auditing tool for their infection prevention and control practices. I think we talked about prevention measures yesterday, so these will be really good tools for you guys to check out. In addition, we have other tools on Foley practices, Foley maintenance practices, as well as central line maintenance practices. We also have wound care practices. So if you're auditing your wound care team, this would be a really great tool for you to take with you for looking at what they're doing. So overall, why is it that we have these ICAR assessments? Why would your facility, or why did facilities participate in this assessment? For a lot of the feedback that we've gotten from the health departments, they have gotten the response that for facilities, having the health department on site, again, in a non-regulatory manner, in a collaborative or partnership manner, provides that opportunity to get someone from the outside to give them the fresh perspective of their infection prevention and control program, as well as it's helped a lot of facilities prepare for the regulatory survey process. And it also helps the facility to identify any infection control risk, as well as priorities and planning activities for their infection prevention and control program. So overall, it's benefited not just the health department as well as the CDC, it's also benefited the facilities to be able to improve their infection prevention and control program, as well as resident and healthcare personnel safety. So now that we have all the data that we've had over the years, I know you guys are curious to see what we've seen. So to date, we've had well over 2,000 facility assessments completed by 44 state or local health departments, mostly CMS certified nursing homes, as well as intermediate care facilities. That has been about 94% of the assessments. In addition, the majority of the assessments have been done on site at the facility. So not just your phone call or your interview, it's been someone being at the facility to see what their practices are actually at. And I have the facility breakdown in the table below, and you guys will have access to the slides so you can review at your leisure. So I'm gonna go into the gaps over the next couple of slides. So the first domain, or the first section of the ICAR tool, talks about infection control program and infrastructure. And overall, what jumps out to us is that only 47% of the facilities, the 2,000 total facilities reporting this data, have said yes to that particular question, which is the person responsible for coordinating infection prevention and control program has received training in infection control. While that seems like it might not be a big deal, only a third of nursing homes within this 2044 have had every single question in this particular domain checked yes. So again, that's a big deal, for us, and you guys have also told us about the training needs that you've had at your facility. And I'll go to the next one, which is healthcare personnel safety, but I won't go into that in detail because the majority of the facilities that were in this assessment, the nursing homes, checked yes. You can see the percentage. There was no percentage that was less than 50, which is good. However, notice that only half of the nursing homes had all elements of the nursing home or the healthcare personnel safety domain in place. Next up is resident safety. So Resident safety, again, did not have anything less than 50%. So again, for the first one, facility currently has a facility policy to assess for the risk of TB that we had 89% said yes. But again, notice only about 50% of nursing homes had all elements of this particular infrastructure checked yes. So, furthermore, the surveillance as well as disease reporting were also seen as strong points, with the disclaimer that, again, only about half of the nursing homes had all elements in this domain in place. So we can see there weren't really that many that had less than 50, but only half had everything checked yes for this. So next up is hand hygiene. Two of the things that jump out here, even though it looks like we're all doing good, right? We're really over the 50% mark, checking yes for hand hygiene. But if you look at D and E, so the facility audits as well as provides feedback, that's hovering around the 50%. The other thing, though, is that only a third, actually less than a third, of nursing homes had all elements of this domain in place at their facility. So while it may look all pretty good, there were two questions that would represent opportunities for improvement within this sample. So next up is our personal protective equipment. And again, the majority of these questions were answered yes, or majority of facilities checked yes for some of these questions. However, the E and the F with the arrow, where again, auditing and monitoring as well as providing feedback to personnel, that was again an opportunity within those facilities. But notice, less than a third of nursing homes had every single element in this particular domain checked yes. So while it looks good, only a third said they had everything in place. So are we noticing some consistent themes here so far? Anybody? Auditing and feedback, right? As well as infection control training. So moving right along to respiratory hygiene and cough etiquette. Again, it seems like this was good because we had all our 63 and 85 as well as 71% and 76 and 92. Almost all seemed like they were good in terms of the percentage, yes, but only 46% had all elements in this domain checked yes. So, moving along to the antibiotic stewardship domain, there are a couple of gaps here that we see consistently. Again, facility having written protocols and antibiotic prescribing as well as reports summarizing antibiotic resistance, as well as providing clinical prescribers feedback about their prescribing practices, and then also the training for both the nursing staff as well as clinical providers is also a big gap. But notice that only 8% of nursing homes had all elements in place. So overall, it may not look as scary, but again, less than 10% had all the questions checked yes. Injection safety. So again, with injection safety, it was more auditing and feedback was the main issue here, and less than a third of the nursing homes had all elements of this particular domain in place. So environmental cleaning, again, auditing was another gap that was seen, 50% did the auditing and feedback, as well as read about that, provided feedback to staff about their adherence. So overall, we have heard from the health departments that leadership investment, as well as support for infection prevention and control at facilities differ. So whether it's your, 0.5 FTE person that's in charge of infection control, how many people are infection preventionists here? Just curious. Show of hands. Okay. How many people do that only? That's the only job in the facility. Oh, wow. You guys get the medal. You are lucky. I hope you know how lucky you really are. How many people have 2 or 3 other hats that they wear? Okay. How many people have more than 5 or 6 hats that they wear? Okay. How many people? Okay. So we have how many people have more than 6 hats that they wear at the facility? No. Okay. So on the average, 3 to 4 or 5 hats. So yes, so we have multiple hats that we wear at facilities. So it's important to remember and learn how to prioritize and juggle the multiple acts that are going on, as well as really taking an inventory of what your infection prevention and control activities are, which is why you always need your infection control assessment, as well as your infection prevention and control plan, to know how to prioritize your resources and to allocate your resources accordingly every single year. What they have also told us, in addition to staff overseeing the infection prevention and control programs lacking training and dedicated staff time, is that there's often gaps with routine auditing of staff adherence to policies and procedures. So you could very well have the best policies in the book, but how do you know that you have the best practices if nobody is watching and recording and tracking and reporting that information back to staff? So I'm gonna get on my poll again. So how many people have auditing and feedback that's routinely done, whether it's every month, every other month, at their facility? Okay. And if you are interested in the auditing and feedback monitoring of practices, we do have those tools at the end of our ICAR assessment. They are free. You can make a copy and most definitely use those tools and let us know, if you need any other tools or any other observation of practice information. Please just get in touch with us and let us know. The other thing that they've noted also is that there's minimal antibiotic stewardship activities in place. As you could see, only 8% of nursing homes had all the elements of the antibiotic stewardship domain in place at the time. But not everything is bad news. There's always light at the end of the tunnel, so that health departments have told us consistently that some of the benefits have been new relationships that have been built with facilities that they would have never thought to walk into, much less contact outside of an outbreak situation. There's also been lots of talks of positive learning experiences for both the facilities as well as the health departments. In addition, some health departments have created infection prevention and control education, as well as technical assistance capabilities with facilities. And this is, a lot of it I think is outside of regulatory requirements. So where they will have, like I said, that point of contact at the local health department or even the state health department, and you could have them on speed dial if you have any infection prevention and control challenges or outbreaks or need any answers to your questions on your program. And also the health departments have in their work identified long-term care training needs to which they have responded to. So some health departments have created, and I put the web links on there so you guys can check it out in your free time, some free training needs as well as resources for not just for their constituents within their state, but for other people. So if you have Google right now, you could probably pull up any one of these tools or website at your convenience. So, for instance, Pennsylvania, and I put the web link at the bottom of this. So, in their response to the state survey agency on having or promoting the use of alcohol-based hand rubs in nursing homes, they came up with some scripted language for their state survey agency because the health department recognized that providers or facilities had concerns about the use of alcohol-based hand rubs, and that was a barrier that they identified. So they ended up coming up with this scripting language or memo and ended up disseminating it to providers all over the state of Pennsylvania. And really it was towards their efforts to support increased access to hand hygiene products within facilities. Another example comes from New York, where New York Health Department developed guidance to support providers for the use of signage when residents are placed on transmission-based precautions. So we have been, and when I worked at the facilities, it was not uncommon to see the See Nurse sign at the door of your precautions, your resident on precautions. Well, the nurse a lot of times was not necessarily behind the desk at the nurse's station. You either had to walk over to whatever room she had for the day, or you had to try to find her in the building. So if you don't have specific guidance to anybody walking into that room as to what specific personal protective equipment whoever walking in the room needs to have on, then you don't provide guidance as to what the expectation would be going into that specific room. So that's another thing that New York helped out their state constituents to craft knowledge as well as guidance on transmission-based precautions, and to say, if you have the PPE that you need to wear going into a room, that does not violate HIPAA, because you're just saying what the PPE is. You're not saying what condition the resident has. So overall, we would definitely encourage you guys to connect to your state Healthcare Associated Infections HAI program. So how many people have connected already to your state HAI program, people? Yes? Okay. And if you have not, I would strongly encourage you. Again, you just go to this website and you can click on your state and it will give you the contact information for your state HAI person. Please get in touch with them and see, how they can help you and support you in really improving your infection prevention and control program at your facility. Go back? Sorry. Okay, sorry. I still have people taking pictures. Sorry. But yeah, another resource that we have is, again, on our long-term care website. So please, guys, check it out. Send us your comments. Let us know if you have any other resources that are not already listed on there that you would want access to. Our CDC guidelines are right there, as well as any other resources that you might need for your infection prevention and control practice at your facilities. So please feel free to check out our website and give us your comments. And that's my email address, bzo2@cdc.gov. So, do we have any questions? And I know I asked you guys a whole lot of questions, so if you don't have any, I'll keep going with my poll.
Are there any questions in the room? All right, thank you.
Okay, thank you.